Good evening, everybody. Welcome to Dr.DWIBHASHI Acupuncture Education Series. Today's topic is on D. Quervain's Tenosynovitis. So, we will dive into the topic and what is this technology we will understand. Learning objectives, as per the previous video, the same thing. Understand the condition, anatomy, symptoms, and management. Definition: an overuse disorder affecting the APL and EPB tendons at the thumb side of the wrist. So this is the thumb side of the wrist, and you can see the thumb of the wrist is the radial side where the thumb and its tendons are located. This is the common area of pain in De Quervain tenosynovitis. In the anatomy, APL, EPB, first dorsal compartment, radial styloid. So as you can see, this is the thumb, and this is the first metacarpal MCP joint, that is the proximal phalanx, IP interphalangeal joint, distant phalanx, carpal bones, trapezius, trapezoid, scaphoid bone, lunate bone, capitate bone, is there hamptate bone, triquestrium, pisiform. Here is the radius and ulna. These are the phalanges. 2 to 5, you can see these are the metacarpals and these are the phalanges. Okay. Risk factors: repetitive work, diabetes, postpartum period, middle age. In diabetes people, this is commonly seen. Symptoms: thumb side wrist pain, swelling, weak grip, painful lifting. Previously, they used to give braces for the wrist. Examination, history and physical examination include the thumb movement. Causes: repetitive thumb use, lifting babies, sports, gripping. This is the thumb and the wrist anatomy chart for your understanding. So radial thumb side view, surface landmarks, radial styloid, bony prominence on the thumb side of the wrist, as you can see, and radial styloid prominence of the radius forms the lateral border of the first dorsal compartment. This is the first dorsal compartment. This is the APL. APL means adductor pollicis longus, helps abduct the thumb all away from the palm. Okay, runs in the first dorsal compartment. That is the thing, but it can't be possible when you have the problem. Extensor pollicis brevis helps extend the thumb, straighten it. So to straighten it, extensor pollicis brevis is there, runs in the first dorsal compartment. So this is the first dorsal compartment. In the fibro-osseous tunnel formed by extensor retinaculum contains APA and EPB tendons. These are the tendons. Okay, both are the tendons. Cross section first dorsal compartment, APA and EPB tendon, radius nerve. So key points are: the first dorsal compartment is a narrow tunnel on the thumb side of the wrist. It contains two tendons, that is APL, EPB. Inflammation or swelling of these tendons, their heat leads to D. Quervain tenosynovitis. Pain is typically felt just below the base of the thumb near the radial styloid. So everybody says the pain is at the base of the thumb. So there is a test to identify whether it is there or not. That is Finkelstein test, a clinic test used by healthcare professionals during assessment. So start position, patient extends the arm and makes a fist with the thumb, fingers, with the thumb inside and the fingers. With the thumb inside and the fingers. Thumb position, examine, grasp the patient with the thumb and holds it. Ulnar deviation, examiner gently deviates the wrist towards the ulnar side, towards the little finger. Okay. So test completed. This position is held for 2 to 3 seconds. Anatomy involved, we know already, I have explained in the previous slide. The positive test is pain felt over the radial styloid and thumb side of the wrist. Okay. The test is positive. if the patient experiences pain over the radial styloid and along the thumb side of the wrist, and during the ulnar deviation of the wrist. Clinical significance. A positive Finkelstein test suggests irritation, inflammation of APL and EPB tendon within the first dorsal compartment consistent with D. Quervain tenosynovitis. Note: you must understand that perform the test gently. Stop if the patient has severe pain. This test is one of the clinical findings. A full clinical evaluation is essential for diagnosis. So laboratory investigations and X-rays, each and everything are important. Differential diagnoses are thumb arthritis, trigger finger, and wrist pain. Trigger finger already I have explained. Please go to the video. Investigation include usually clinical imaging and selected situations. Treatment: splitting exercises, activity modifications, medicines when appropriate. Thumb stretch exercises for D. Quervain tenosynovitis. These gentle stretches help reduce tightness, improve thumb mobility, and decrease pain on the thumb side of the wrist. Do gently stop if pain increases. So, thumb extension stretch. Gently pull the thumb backward away from your palm with your other hand. Hold and relax. Thumb flexion stretch. Gently bend your thumb across your palm towards the base of your little finger. Hold and relax. Thumb abduction stretch. Gently pull your thumb away from the palm outward and hold it. Open your hand and thumb to make a C shape. Feel the stretch at the base of the thumb. Touch the tip of the thumb to the base of your little finger. Hold and relax. Guidelines. Hold each stretch for 15 to 20 seconds. Repeat 3 to 5 times. Do 2 to 3 times per day. Stretch should be gentle and pain-free. Stop if pain increases. Tips are: move slowly and breathe normally. Warm up your hands before stretching. Consistency is a key for better results. Benefits: reduce thumb and wrist tightness, improves thumb flexibility and movement, helps decrease pain and inflammation, supports healing and prevents recurrence. Exercises: thumb stretches and tendon gliding exercises. These exercises help the tendons glide smoothly through their sheets and reduce the stiffness in thumb and fingers. How to perform each position: slowly, gently. Hold each position for 3 to 5 seconds. Repeat the sequence 5 to 10 times. Do 2 to 3 sessions per day. What are the benefits you can see? Improves tendon movement, reduces pain and stiffness, prevents adhesions, enhances hand function. So this is the straight hand. Start with your hand straight and fingers extended. Bend the middle and the end joints of your fingers. Keep the thumb straight. Make a full fist by bending all fingers and the thumb. Bend the knuckles, that is the MCP joint. Keeping the fingers straight at the middle and the end joints. Curl your fingers at the knuckles. Now your thumb rests over the fingers. Gentle touch the tip of your thumb to the base of your little finger. So this is what I want to explain. So return to the starting position with your hand open. So for everything, consistency is the key. Regular practice helps maintain tendon gliding, improves mobility and supports long-term health. Ideal for D. Quervain tenosynovitis. These tendon gliding exercises are also used for stiffness in the thumbs and fingers, post-immunization or injury recovery, early arthritis or tenosynovitis management also. Acupuncture may be considered for selected patients with a comprehensive treatment plan. Prevention: ergonomics, regular base, avoid repetitive strain. Patient advice: seek medical review if symptoms persist. Myths: not all thumb pain is due to a. Key takeaways: early diagnosis supports better recovery. References: evidence-based musculoskeletal care. So thank you very much for today's topic. I have given my appointment number also. So I request you to please go to the site. That's all for today. We will see you tomorrow. Thank you.